Hi, my name is Didi Jimenez, and today we're going to go over the hormones Vasopressin and Oxytocin. But before we start, keep in mind that both of these hormones are secreted in the hypothalamus and posterior pituitary, meaning they are stored and released by the posterior pituitary and synthesized in the hypothalamus, not made by either of them. Okay, now let's take a look at our first hormone, vasopressin, which is an antidiuretic hormone in charge of aiding blood vessels during constriction and helping kidneys fulfill their duty in maintaining balance of water and salt within the human body. This hormone comes with two major effects. The first results because of its antidiuretic qualities, and it is when urine formation by kidney nephron occurs, vasopressin helps with water conservation. The second effect is common to vasopressors. In this case, it's arteriolar smooth muscle contracting due to vasopressin being the primary endocrine factor, allows this hormone to regulate loss of urinary water and just balance water overall throughout the body. This antidiuretic hormone also plays an important minor role in regulating blood pressure through arteriolar vasoconstriction. Moreover, input for the release of vasopressin comes from the hypothalamic osmoreceptors, which result from an increase of plasma osmolarity. This is known as the hypothalamic-induced release of our hormone. The last way this can happen is through the fall in arterial blood pressure and EFC volume that comes from the left arterial volume receptors. Now, moving on to our second but last hormone, oxytocin, also known as the love hormone because of its effects on behavior, more often maternal behavior. During childbirth, contraction of uterine smooth muscle occurs in response to oxytocin. Not only this, guess what causes milk to eject from mammary glands? That's right, oxytocin. Now, to clear things up, oxytocin comes with two psychological effects. The first being when a mother is giving birth, reflexes within the birth canal occur, which lead to an increased secretion of oxytocin. Number two being the secretion of this hormone increasing as a result from a baby suckling at the mother's breast. Now the true question is, why are these important? Let's take a look at central diabetes insipidus, an endocrine disorder that affects 1 in 25,000 individuals. In our case, 55 adults were categorized into three groups: CC, clinical control, HC, health control, and CDI, central diabetes insipidus, in order to study how to minimize deficits using intranasal oxytocin administration. First, I'm going to go over that administered test and then the results. In order to diagnose CDI and anterior hypopituitarism, researchers conducted water deprivation test and basal and dynamic test of anterior pituitary function. The next test conducted was RMET, which presents 36 facial expressions, and the task is to identify the feelings by just viewing the eyes. I have an example of one of those here. That would be this top picture here, and you are to guess what this man is feeling just by looking at his eyes. Me personally, I looked at the words and I didn't think any of them. I thought he was being questioning something. After this, researchers used facial emotion recognition, or FER, which is a little more intense. It takes 96 expressions at different intensities, and an individual has to identify which expression out of the 5 basic ones the individual is feeling. These are 1, happy, 2, angry, 3, fear, 4, sad, and 5, neutral. Here I have a small sample of that test in order to measure personalities. That would be this bottom picture here. That's opposed to different intensities. The next task conducted was an interpersonal reactivity index, which is a questionnaire that has the following subscales: empathetic concern, fantasy, personal distress, and perspective taking. Now, that's a lot, but we only have 3 more tests to go over. The next one was an AQS, which is a shorter version of the autism quotient. This test contains 28 items and the results are taken from 5 subscales: social skills, mind reading, restricted and repetitive behavior, imagination, and attention to detail, in order to measure how often an individual demonstrates autistic-like traits. A 9-item relationship questionnaire was also given in order to determine an individual's relationship with their parents. And lastly, we have our oxytocin sampling and analysis. This task used passive drool saliva in order to measure oxytocin. Lower rates of nonspecific binary made saliva a better medium over plasma samples, and the fact that it is non-invasive. Now, moving on. Medical characteristics of our results are as followed. For our CDI group, which is our central diabetes insipidus group, over 75% of participants had concomitant partial or parapituitarism. 45% had to have surgery for craniopharyngioma, which commonly causes CDI. 25% of these individuals had a history of GH, prolactin, or both as a result of a tumor, and 10% had non-functioning pituitary adenomas. On the contrary, our CC group, our clinical control, had 80% partial anterior HP, and the rest parenhypopituitary. Amazingly, only one patient needed surgery for craniopharyngioma. 40% of these individuals had a history of the hormones mentioned due to tumors, and only 33% had non-functioning pituitary adenomas. Our interpersonal reactivity index showed lower trait empathy in our CDI and CC groups in comparison to our HC patients. For our autism quotient, there was no difference in HC and CDI, but our CC group did have lower scores. Our ECR test showed no effects that stood out or interactions. All of these results put together give us our chart shown on the left, giving us the concentration of oxytocin. That would be this one. For hypopituitary and healthy control patients. Now, for our empathy analysis with lower RMET scores, we have our CDI and CC groups as seen in our middle graph. These two fell in the lower category, obviously, as you can tell. The graph on the right shows us different intensities. We can see that fewer expressions were identified by our CC group at some intensities than our HC group. Our CDI and CC groups showed no differences, which is very rare. In conclusion, patients with acquired CDI were investigated to determine whether they would also have OT deficiency. Our HP patients had a lower concentration and lower scores than HC, but they weren't significantly lower. This being said, with HP having lower scores, higher deficiencies, we can say that HP had a lower oxytocin concentration deficiency and cognitive empathy. But as everything with science, more research would have to be conducted to make this a solid in stone result. Well, guys, we have reached the end of our presentation. These are our resources. If you want to look further into them, it was a very interesting article to read. Thank you for your attention. See you on the next one.